Hello students, we will discuss a condition which is again common, very interesting and often difficult to manage and needs a real evaluation method. What are the differential diagnosis? Let's see, look at the swelling in the nape of the neck, quite large, surface is smooth, there is dilated veins, this is very typical, see that dilated veins here. See that swelling is so large in the nape of the neck. So you have to, it could be benign like a lipoma, but if it is short to duration, progressively increases so much. So you have to think of sarcoma. So it is, put it together, soft tissue tumor. It can be benign, it can be malignant. So if it is short to duration, it could be malignant. Long duration, it may be lipoma. So, or benign tumor. So, could be benign large lipoma, can be soft tissue sarcoma. So, based on the history, based on the clinical palpation examination, you will be able to differentiate. The dilated veins are probably in favor of sarcoma. Then look at the consistency, surface, skin involvement, long duration, then it probably lipoma. So, like that, other features also you have to consider to give a final clinical diagnosis as such. So remember, as far as soft tissue sarcoma is a very vast subject, students has to know because it can be kept as a short case or long case. You have to examine in detail, you have to examine regional nodes, even though sarcoma main spread is blood, but a few sarcomas also spread to the lymph nodes. Then you have to neck lymph nodes and axillary lymph nodes, both sides you have to examine because in the midline. Then look at the surface, skin, consistency, mobility, fixity, vascularity, everything. Then systemic exam, mainly lungs, because sarcoma mainly spread to the lungs. Blood spread is very common in sarcoma. So there is a point you have to remember. Other systems like liver, abdomen, bone, also it can spread. So every system has to be examined properly to clinically assess the metastasis as such. And remember, true cut biopsy or open incision biopsy is the ideal investigation for suspected sarcoma patient. Before that, we may have to do MRI of the area, soft tissue MRI of the area, and CT scan of the systemic area, CT chest, CT abdomen, and CT brain, MRI of this area to assess the local part. Then incision biopsy or true cut biopsy is the ideal investigation. No FNAC. FN is not a good investigation. Sometimes you have to do the PET CT because lesion is quite big. So it may be T4 lesion based on the dimensions, 5 to 10, 15, more than 15 like that. So then assessment of primary, metastatic work, PET CT scan, immunohistochemistry, FISH, fluorescent in situ hybridization, tumor markers are very important to find out eventually what type, grade, everything. Undifferentiated pleomorphic sarcoma and liposarcoma are the commonest type. Now staging is a GTNM staging, different from the usual TNM staging. Grading, tumor, node and METs, and grading again it is called as FNCLCC based on the tumor differentiation, mitotic count and tumor necrosis. All these things are important, very commonly asked staging system in GTNM. That point also important. Remember, CT and MRI. MRI is very important. CT for the systemic evaluation and PET CT also very useful. And true cut biopsy or incision biopsy, no FNAC. That point has to be remembered. So benign tumors will not turn into sarcoma except nerve sheath tumor or lymphedema. Lymphedema sometimes turns into lymphangiosarcoma. There is Stewart-Travis syndrome, it is called as. Nerve sheath tumors, neurofibroma can into neurofibrosarcoma. But lipoma, benign, will not turn into liposarcoma. Similarly, other benign tumors will not turn into corresponding sarcomas. There is what current concept is. And treatment is neoadjuvant chemotherapy. If it is a large one, then give a wide local excision, then continue the chemotherapy. Radiotherapy may have to given. Adjuvant chemotherapy, VAC regime, vincristine, adriamycin, cyclophosphamide, MESNA, MAID regime, MESNA for hemorrhagic cystitis, cisplatin, and all those things are important. You must resist criteria and choice response criteria are important to see the assessment of the response for the treatment, complete reduction, partial reduction, flow restriction, and these points are important, CR, PR, ZD and DD, so that how to assess. So sarcoma is a wide topic, please read and understand because it is kept a short quiz. And theory, it may be as a long case or short case, short notes or long notes, long answer question or short notes in the different aspects of the short soft tissue sarcoma. Remember, you have to read a short sarcoma in detail properly. It is a very common entity. And answer this MCQ. Most common sarcoma in child is fibrosarcoma, liposarcoma, undifferentiated pleomorphic sarcoma, rhabdomyosarcoma. Put it to right answer in the comment box. We'll discuss about that in the comment box. Students, go through my clinical methods in surgery with video lectures in detail, how to examine different patients. My manual surgery details about the topic, and operative surgery to all limbs details about technique. My video lectures, DigiNow through JP, all topics are covered well in detail with the proper illustration lectures, operative surgery specimens, instruments, images, and specialties basic. It will be helpful for UGs and PGs. So students, I hope you understood this lecture very well. Thank you very much.